our Howard County Executive, Dr. Calvin Ball, County Council Chair Deb Young. I just want to extend special thanks for instrumental leadership and support in passing the budget, which is very important for us to get this done, so thank you. Councilwoman Christiana Rigby, Senator Guy Gazzone, instrumental for us. Senator Clarence Lamb. Delegate Courtney Watson. Delegate Pam Gazzone. Delegate Jessica Feldmark. Delegate Terry Hill. And lastly, on behalf of Senator Chris Van Hollen, Regional Director Jessica Plattman. I also want to take a moment to welcome our foundation board, our board of trustees, community healthcare partners, and our generous donors that are here today. We've received tremendous support through the different phases of this expansion project, including as a part of our new campaign, Together, Let's Support Our Neighborhood Hospital. A special thank you to Kirsten Baer, our Vice President of the Foundation, and her illustrious team who have helped put all this effort into getting this day together. So thank you so much for that. And I do want to thank some of our special donors, Earl and Mary Armiger, Kathy and Danny Bell, Charlie Miller, and the Rotary Club of Columbia. So behind the scenes, none of this would be possible without the support of our leaders, our clinicians, and our staff. I do want to give a special shout out to our Vice President of Operations, Mr. Ryan Brown, who has led this project with an outstanding team, delivered it before the deadline, so he kept his promise to me. And we also want to thank other folks who were in the facilities, Erin Hernan, Katie Barbagallo, Kate Whitmore, and Danae Mayas. We are deeply appreciative and grateful for the expertise of Dr. Patricia Pugh, the medical director of our emergency department, and Dr. Angelino, the medical director of psychiatry. Their valuable insights shape both the design of this unit and operational protocols that will guide its success. A special thank you to Kristen Moore, our psychiatric nurse manager, who will lead the exceptional team for caring for our patients in our behavioral health unit. And a heartfelt acknowledgement to our project partners, Gil Bain, the general contractor, and Cannon Design, the architect. As many of you know, Howard County Medical Center and hospitals nationwide have experienced dramatic increases in our emergency department visits, and specifically emergency department behavioral health visits. The emergency department is often the first entry point for people in mental health distress, and we see this firsthand every day. So until recently, our ED did not have adequate space to take care of the demand that we have. And I'm proud to share that we have taken significant steps to address this issue with this behavioral health unit that you're standing in today. So we have created spaces that are ideal for healing for our patients and taking care of all of our constituents that come in. We more than tripled the size of the unit, increasing our capacity from just 6 patients up to 24. This expanded space allows us to better accommodate the needs of individuals who are experiencing mental health crises. And the behavioral health unit is more than just a response to one demand. This is one component of a strategy that we hope to alleviate pressure on our emergency department and improve our overall hospital efficiency. It's also important to keep in mind that as we manage the complexity of patient care and flow, we have to have a multifaceted approach. And we are implementing several innovative projects to ensure that our staff can continue to deliver high-quality, safe care for all patients. Our discharge hospitality suite helps free up inpatient rooms by supporting patients ready to go home. And that makes space for those arriving in the ED who need to come upstairs. And next year, we will begin construction on a new observation unit for patients who need observation before a decision is made to discharge them or admit them. This will further improve our throughput. So thank you again for your continued support and for being part of today's milestone. We look forward to continuing to work together to enhance the care that we provide for Howard County and the region. Thank you very much.
Good morning, everyone.
Morning. Morning. Morning.
I just want to make 2 quick points. One, Thank goodness that over the last several years, we've begun talking about mental health and behavioral health. Thank goodness it's recognized as an issue that we have to address. And the second point, of course, is more than talking about it, doing something about it. And here we are. And you know, I think it really says a lot about our community. And that's the beautiful thing about Howard County. And the thing that I'm so proud of, that we said, yeah, we're going to do something about it. We're going to make this place. We're going to make it a better place. We're going to make it a welcoming place. And that's the exciting part, right? People's lives are going to be improved here dramatically. Thank goodness. And they deserve that. We all deserve that. We all deserve health care, all kinds of health care. And so, as a member of the state legislature, I was very pleased that our delegation worked together and we were able to come up with $2.6 million for this project. It's part of the deal. And the good news is that there are so many people in this room, all who recognize that we need to care, that it matters. Every life matters, and we need to do what we need to do to deal with these very challenging issues. So I'm just thrilled to be here. I'm thrilled and thankful to the broader community, to the hospital. This is really a good thing. It's a good thing for all of us, and I'm just very thankful.
Thank you. Now I'll take Dr. Tom Ball, our county executive.
What an exciting day for Howard County and the great state of Maryland. I can't tell you how glad and proud I am to be here at Johns Hopkins Howard County Medical Center today with so many community partners and leaders to launch the next steps for this important initiative for Howard County, for our hospital, and most importantly, our community. The Maryland Hospital Association reports that hospital visits for behavioral health increased from approximately 10.5% in 2013 to over 18% in 2021. And we anticipate those numbers will continue to rise. As a county and as a community, we will continue to invest in preventative care and behavioral health infrastructure to ensure that every resident has access to the care needed to live a healthy, full, successful life. To address our behavioral health care needs, I included $1 million in my budget earlier this year and recently announced an additional $1 million in my upcoming budget proposal for the hospital's new behavioral health unit. Thank you for the applause, but I'm going to share that applause with our county council who actually approves my budget. So thank you, county council. This investment will enable the hospital to proceed with new, transformational, 7,000 square foot behavioral health unit with 24 beds. And this impactful increase will be over the 5-bed facility that was part of the hospital. 5 to 24. The new behavioral health unit will ease overcrowding in the hospital and ensure more of our neighbors are able to receive the timely and supportive care in an environment that supports them. This county commitment is joined by state and philanthropic contributions, and I want to give a special thank you to my very dear friend, Senator Guy Gazzoni, who you heard from, and our entire state delegation. Please give them a big round of applause again. This would not have happened without our partners in Annapolis, and this also would not have happened without the generous donors and the philanthropists who gave, and I'm not going to start listing because then I'll be here all day, but thank you. Now, during my time as your county executive, my team has committed more than $12 million to support numerous efforts that enable our hospital to to better serve the public. These dollars, which have been far more than previous years, have been used to fund capacity enhancement to help during the COVID-19 pandemic, community health initiatives, and emergency room enhancements. And with this transformational investment in our new behavioral health unit, we are advancing our efforts to support those who are experiencing mental and behavioral health care crises. It allows people to seek help, receive proper treatment, and lead fulfilling lives. It will also help free space in other units like the emergency room and impact wait times. These partnerships make clear that when we work together, address issues strategically, and take a truly holistic approach, we save lives and build a healthier future for all. This is a reminder that mental health is just as important as physical health. And today, we are taking a giant leap forward in helping so many of our neighbors who unfortunately are suffering in silence. Thank you so much, and God bless.
Council Chair Deb Young to come up for a county proclamation.
All right, I just had to exaggerate that for a moment. First of all, I look out at this group and I say, every single person here I know was critical to doing what we are looking at today. And in particular, my colleague here, who was chair of the council when we passed this budget to approve the millions of dollars that help make this center come to light, that we are all enjoying and that we know will be so important to this community. Dr. Ahmed, your leadership on this project has been so important to getting it to where it is today. And I know, yes, thank you very much. You were critical, and I look at the other elected officials who are in this room who probably remember those 8 a.m. breakfasts that we had with Dr. Ahmed and his staff 2 years in a row, where he was making the pitch to please help us get the money to build this center. And he was successful because he knew how important it was, and he was able to convey that to each one of us in a way that made us say, okay, we're going to pass that budget. And I know that the state did the same thing. And I thank you not only for making sure that we were a part of this process, but also making sure that we had the education that we needed in order to see why this was so important and how we could then talk to our constituents about this very project. So we have a certificate of recognition today that I would like to share with everyone. As the chair of the Howard County Council, I'm honored to recognize the grand opening of the Medical Center's new behavioral health unit, which will provide more timely and effective care to patients experiencing mental and behavioral health issues. The Medical Center's emergency department currently admits an average of 250 adults and children per month suffering from mental and behavioral health issues. This new unit adds 18 beds to the previous 6 beds for this growing medical need and will make more space available in the main emergency room, yay, for patients seeking other types of care. Would you like to read the rest of it?
Sure. This brand new 7,000 square foot behavioral health unit is partially funded by the County Council's approval of $2 million appropriated in the FY24 and 25 budgets. This financial commitment by the county made a significant impact in helping the medical center reach its goal of securing $10.3 million for construction costs. On this 18th day of November 2024, we congratulate Dr. Ahmed as well as the leadership and medical teams of the Johns Hopkins Howard County Medical Center on the grand opening of the new behavioral health unit, and we wish you continued success in improving the health outcomes of Howard County residents. Thank you.
Yes. Thank you, thank you, thank you.
Thank you, Dr.
Very
Young.
excited about
Mark, Council Chair. and the entire county council. At this time, we'd like to invite Dr. Andy Angelino, our Director of Psychiatry, up.
Well, I just want to say thank you all for coming. It's wonderful that you're all here supporting us. You've heard the statistics and everything. We have about 250 patients that come in every month for evaluations. The time when they come in is one of the most critical times for them. It's very difficult. And the space that we had was not exactly what you would call healing and comforting. It was small and kind of in the corner where psychiatry has been for a long time. Not that we should be there. We should be out here in these nice big bright spaces where people can feel welcomed and they can feel comfortable, and we can get around to helping them out. The tougher part is the amount of time they spend, which can be a long time if you're waiting for a bed. If you're going to be admitted to the hospital, you may be here over a day, which is why we really needed some more rooms with beds in them, more facilities, showers, bathrooms, just to help make people much more comfortable for their time. We're much less cramped in here, and we have windows. One of the problems we had in the other place, there's no windows, so everybody referred to that as the dungeon. I was down in the dungeon, and then they brought me up here. The unit upstairs is really nice. It's almost as nice as this. I mean, it's we every couple of years we make steady improvements. This whole thing, I will say, began 10 years ago. When they asked me to come here and take over the Department of Psychiatry, this was the old psych unit. It was awful. It was not designed well for safety. It was not designed well for being a healing, comforting space. It was kind of just what happened with a lot of psych units. And we came in, and the Board of Trustees was very supportive and said, build a new building, the 2 West building, we have a brand new unit, state of the art, it's fantastic. As that space cleared out, we came down here and we started looking at that. We had a little hiccup for a year and a half with this pandemic thing that happened, and we ran a COVID unit out of this where I attended a lot. But once that was over, it was picked back up as a project. And I have to tell you that it is only because of the visionary leadership of Dr. Ahmed and the executive team, as well as all of our legislators and executives from the county and the state, that we were able to do this. Howard County is now a place where people are going to get the kind of health care and the kind of mental health care and behavioral health care that they truly deserve. You heard the word neighbor a lot here, and that's how we treat everybody. We try to remember these are our neighbors. These are the folks that are around us. And every one of you in this room knows somebody. If you don't have a problem yourself, you know somebody who has a behavioral health problem. It's about 2 out of 5 people. So I always say, look to your left, look to your right. One of the 3 of you is probably going to need to talk to somebody at some point. And that's okay. That's what we're here for. We're here to help. So thank you all very much for coming. I'm really, really excited that you're here, and I'm really, really excited to be able to serve all of you in this wonderful new space.
Thank you, Dr. Angelino. And finally, introducing Dr. Patricia BHU, our Chair and Medical Director of Emergency Medicine.
Thank you. Good morning, everyone. Good morning, everyone. Thank you so much for being here. Thank you for joining with us and celebrating in the opening of this really beautiful unit. Look around you. As an emergency physician, daily I bear witness to the growing number of patients presenting to our emergency department with an acute mental health crisis in need of an acute intervention. As you've heard before, we currently have had 6 spaces without the natural light in order to provide care for these patients, where on average we see 11 patients per day. Those additional patients have been cared for in our medical treatment bays, treatment spaces that were never designed to provide hours and hours of ongoing care to our patients. Some of these patients are patients with complex behavioral health conditions. Some of them are elderly. Some of them have neuropsychiatric diagnoses. Now, we have this space, which is so important, and I can't thank you enough, Dr. Ahmed. This started off as a kernel of a dream, and it's materialized to this beautiful, beautiful unit. I can't thank you enough for this. And now we're able to treat our patients with the care the expertise, and the dignity that they all need. I can't thank the members who've been mentioned already, County Executive Dr. Ball, Senator Gazone, all of our delegates, our partners, for helping us materialize this dream. There's a proverb that says, if you want to go fast, go alone, and if you want to go far, go together. And this is a manifestation of us going far. Thank you.
Thank you, Dr. Pugh, and for everybody for coming out. We are now going to be doing some guided tours. We're going to do a ribbon cutting really quickly. If we can have everyone come up to the stage for the ribbon cutting that was invited for that. And then we do have our staff back there that can give you guided tours of the unit. They can let you know about all the different features that we have. Thank you again for coming out tonight.
Go ahead. 3, 2, 1.